Today, we are getting right under the skin of a super common and, let's be honest, super annoying issue. We're talking about those little red bumps that pop up and look so much like acne, but they're just not. We're diving into folliculitis and we're going to figure out exactly what it is, what's causing it, and most importantly, how to deal with it.
You know the moment, right? You spot a little red bump on your leg after shaving, or maybe on your back after a tough workout, and you think, oh great, another pimple. But what if it's not a pimple at all? What if your skin is actually trying to send you a completely different message?
All right, let's become detectives and unravel this common skin mystery together. And we're going to start with the most basic question of all. What in the world is folliculitis anyway?
So at its core, it's actually pretty simple. Folliculitis is just the official kind of fancy word for an inflamed hair follicle. You know, those tiny little pockets in our skin where each hair grows from. And since we have hair pretty much everywhere, yeah, this little problem can pop up in a lot of different places.
And this, right here, is the key difference, the dead giveaway. See how the irritation, the little red bump, is centered right around a single hair? That's the telltale sign of folliculitis. It might be red, it might be a little swollen, and yep, it often has that classic whitehead, which is exactly why it's so incredibly easy to mistake for regular old acne.
Okay, so what's actually triggering this inflammation? What is going on with that tiny little hair follicle to make it so angry and red? Well, as it turns out, there are a few usual suspects we need to look at.
A lot of the time, it's not just one thing. The most common culprit is a bacteria called Staphylococcus aureus, or staph for short, which, funnily enough, normally just lives on our skin without causing any trouble. The problems start when it finds a way to sneak inside a follicle. But it's not always bacteria. Other causes can be yeast, simple irritation from shaving, or even just friction from tight clothing. I mean, think about your workout gear trapping all that sweat against your skin.
This quote really nails it. It's the perfect way to picture what's happening. Think of a healthy hair follicle like a tiny house with a locked door. But when that follicle gets damaged, maybe from friction or you nick it while shaving, that lock is broken. The door is left wide open. And all those bacteria and fungi that were just hanging out on your skin now have a wide open invitation to come inside, make themselves at home, and start causing trouble.
But here's where it gets a little more complex. See, not all folliculitis is created equal. And knowing the specific type you're dealing with is absolutely key to treating it the right way. I mean, it makes sense, right? You wouldn't use the same approach for a bacterial issue as you would for a fungal one.
So let's compare a couple of these. On the left, you've got your standard bacterial folliculitis, usually from that staph bacteria we talked about. These are those classic itchy, white-headed bumps. But then, on the right, you've got something totally different, hot tub folliculitis. This is caused by a different bacteria called Pseudomonas, one that absolutely loves to thrive in warm water that isn't maintained properly. So, if you get a bunch of red, itchy bumps a day or two after a soak, this could be why.
And check out these two distinct types. First up, razor bumps. Now, this one's a bit of a trick because it's not a true infection. It's an inflammation caused by ingrown hairs curling back into the skin after shaving or waxing. Ouch. Then you have Pityrosporum folliculitis. This one isn't caused by bacteria at all. It's yeast. It's a yeast overgrowth that creates these chronic, really itchy red pustules, and you'll often find it on the back, chest, and shoulders.
Okay, so we've identified the problem. We've looked at the causes. Now for the part you've been waiting for. How do you get rid of it? Let's talk about your path to relief and taking action. The great news is, for most mild cases, you can totally manage this at home. First, apply warm compresses. Just a warm, moist cloth held on the area a few times a day. This helps soothe the inflammation. Second, gently wash the area with a medicated cleanser like an antibacterial soap. Third, and this is a big one, reduce all irritation. That means taking a break from shaving, no scratching, and switching to loose, breathable clothing. Finally, you can soothe the skin with over-the-counter antibiotic creams or even a little hydrocortisone lotion to help with the itch.
But, and this is really important, you have to know when at-home care isn't cutting it. If you see the bumps are spreading, if they become genuinely painful, or if you've been trying these things for about a week with zero improvement, that is your cue. It's time to see a doctor. Some cases just need a stronger prescription-level treatment to really knock them out.
Of course, the absolute best treatment is not getting it in the first place, right? So let's wrap this up with a few key prevention strategies to help keep your hair follicles happy, healthy, and clear. All right, here's your game plan. Avoid that super tight clothing, especially when you're exercising. When you shave, do it with care.
Use a clean, sharp blade, shave with the grain of hair growth, and always moisturize after. Be a little picky about your hot tubs. If it looks or smells even a little bit off, just skip it. Make it a habit to keep your skin clean and dry, especially right after you sweat. And you might want to consider using a gentle exfoliating cleanser every now and then to help keep those follicles from getting clogged up. So, what is the single most important takeaway here? It's this. You have to become a detective for your own skin. The real key to managing folliculitis is figuring out your personal triggers. Whether it's friction from your favorite jeans, a dull razor, or lingering in your gym clothes for too long, figuring out what causes your flare-ups is the most powerful tool you have.
So the next time you see one of those little red bumps, don't just get frustrated. Get curious. Take a moment, take a closer look, and ask yourself this question. What is my skin trying to tell me? Because listening to that signal is the very first step toward feeling better in the skin you're in.